Welcome back, everyone. This morning we are continuing the conversation about a painful condition that affects a lot of women, endometriosis. As we explained yesterday morning, women frequently ignore the symptoms, thinking what they're feeling is just normal monthly discomfort associated with their menstrual cycle. But that is not always the case. And it is so important that we understand this. So Dr. Samuel Brown, a local fertility specialist, joins us live via Zoom. Thanks for talking about this. I think this is something so many women need to talk about. Sometimes it doesn't come up until they want to get pregnant. So again, would you explain what is endometriosis and how it affects the body?
Sure. Endometriosis is inflammatory cells that live outside of the uterus in the pelvis. So it can cause cramping, pain, and infertility. In some women, it doesn't cause pain at all, but it just causes infertility. But the one you see and hear of mostly is those that have a lot of pain and discomfort around the time prior to their period, during their period, usually prior to their period. And it causes a lot of discomfort. People have to stay home from work or school because of the pain. It really is a devastating, can be a devastating pain and discomfort and inconvenience. It's really common.
Let me ask a question, though, because I think, women who menstruate every month, deal with certain symptoms anyway. And you're like, oh, this is just normal. At what point, I guess my question is, you should probably always talk to your doctor if you're feeling something different or if your periods are heavier than normal.
Yeah, with any discomfort, like at an annual exam for a woman, it should be brought up. It shouldn't just think, oh, this is normal. Any type of cramp or feelings or sensations should be described to the doctor, and that can lead toward proving endometriosis.
So what happens if this condition continues over time and it just goes untreated?
Well, it can worsen. The pain can get worse over time and lead to more days off work or days out of school. And there are fixes for this. There's medical medicines that we can use. There's surgeries. There are it doesn't have to be just a hysterectomy. There's a lot of conservative medical treatments that we have to make quality of life much better.
And let's talk about women who, one day want to get pregnant and they find out they have this condition. Addressing that sooner than later is important because is there a waiting period if you do, let's say, have to have surgery before you can get pregnant?
If a couple's having difficulty conceiving, they should come in and see a fertility specialist. Insurance pays for that. It's pretty easy to get in and talk. And we have many modalities around it. We can use typically the simpler fertility treatments will work, but there are more aggressive fertility treatments that will work. So we have lots of ways to treat this issue.
All right, Dr. Brown, thank you. I think it's so important we have these conversations so that women do not have to suffer. So again, if you're having any of those sensations, just talk with your doctor. It could be an easy fix, and it could lead you down a road of full recovery. All right, have a great day.